welcome to attend the press by the State Council. In the recent days nationwide, the pandemic has maintained a stable control, but in certain places we see some concentrated outbreak, so we are still facing severe situation. We must pour all our energy towards prevention, early discovery, early reporting, early isolation, and early treatment. We must continue to be committed to the prevention and control of both people and items. And as to people who come inbound, and those people in their close contacts, and the people working on the posts of high risks, we must have closed-loop management. In the public places, we must adhere to the usual works of protection, for example, facial mask, temperature check, and indoors, we must have good sanitation habits so as to cut off the transmission. And also we must galvanize the resources of the whole country to prevent and control it. Today's focus is about pandemic prevention and control with the testing. And we have with us from the National Health Commission, Madame Guo Yanhong, from Beijing CDC branch, Deputy Director Li Yang, from National Health Commission, Clinical Investigation Center, Mr. Li, Jingming, and the CDC Disease Control Director, Mr. Xu. They will take your questions. And please raise your hands before identifying your question. The first question goes to the second reporter in the first row. Thank you. From China Daily. We've seen that there are some concentrated outbreak in certain cities. The people have frequented some places, but in those places they have varied requirements of nucleic acid test. So what are the criteria for the test reports within the last 24, 48, or 72 hours? And what are the grounds for such requirements? Will the nucleic acid test be a regular requirement in the near future to enter into the public places? Mr. He. Thank you for the questions. We must consider the needs of containment to make scientific requirements of nucleic acid tests. And we identify the scope of the tests and the frequency of the tests accordingly. We cannot blindly scale up the all masses tests. And for the tested people, based on their risk levels, there will be gradual tests taking on. And for the contained areas, they must complete the first round test within 24 hours. In the controlled areas, the time period is required at 48 hours. So, the criteria is based on the containment measures, and we must have a general arrangement of the frequency of the test. Like I said, 24 hours of all masses test in the contained areas because it's highly risky. And for the controlled areas, the time requirement is 48 hours for a nucleic acid test for all the masses. As to the intermediate risk or higher risk levels, the people cannot go out. But as to the others, if they do need to go out, they must take the nucleic acid test within the last 48 hours, and all the localities can readjust accordingly. For people with no risk of imported case and with no outbreak, such a nucleic acid test requirement should not be regular in the future. And we also would love to hear from Mr. Li Yang as to the practices in Beijing. Thank you. Just now, according to Tsinghua, there are some national requirements for the test. And in Beijing, we are gradually and orderly resuming the normal life and work. Recently, according to different districts and different risk levels, we have come up with some regular containment measures to maintain the consistency of the policies and have an early identification of the risks. Beijing now, if you want to enter into the public places, the nucleic acid test time requirement has been readjusted to 72 hours instead of 48 hours based on two considerations. First, the Omicron virus has a probation time of 3 days. So within 72 hours' time, nucleic acid test is able to identify the potential risk. And secondly, we would love to reduce the frequency of the test by the civilians so that we could try to minimize the burden on the civilians and minimize the impacts over normal life and production. In the next step, based on the change of the pandemic situation and based on the results of the risk assessment, we will dynamically readjust the different containment measures. The CPC Central Committee raised the ideas of stabilizing economic recovery and safe development guarantee and pandemic containment. We will act accordingly in that regard. Next question. From CMG. Days ago, according to national document, the big city development must set up such a sample-taking circle within 15 minutes walk. Some people think it's too demanding. What's your take on that? And for the massive construction of the 15 minutes time radius of the sample-taking station, is it necessary? Madam Guo Yanhong. Among all the containment measures, nucleic acid testing is the manner to timely localize the risk points and signify certain isolation measures to cut off the transmission. It helps to have early identification, early reporting, early isolation, and early treatment. In terms of containment, nucleic acid test is very helpful, especially as we know Omicron is highly transmissible and it can be transmitted very fast. Particularly, there are a large number of asymptomatic carriers. So the role of nucleic acid tests is even higher. So we centers on nucleic acid test in our overall strategy of prevention and control, so as to have early and quick control of the virus. In our regular containment measures for the port cities, the provincial capital cities, and cities with over 10 million population, considering the high risk, to establish such a sample-taking circle within 15 minutes walk is conducive to test as many people as possible. And that policy will offer convenient sample-taking services for people. It also helps to build our sensitivity to the pandemic and will cement our system of early discovery of the potential risks. Then we can act more quickly in prevention and control, so as to avoid an explosive growth of affected people. I have to emphasize that such a sample-taking circle within 15 minutes walk is not targeting at all cities. We are now looking at the riskier metropolises which are highly populated. Whether to establish such sample-taking stations within 15 minutes walk and the frequency of the sample-taking must be decided based on the local prevention and control requirements. We must have customized methods instead of one-size-fits-all policy. China is the largest developing country with a large number of elderly people and unbalanced regional development. In some places, the medical resources are inadequate. Once there is an outbreak of local case, in a short time period, there must certainly be a large number of infected people. For the elderly people and the vulnerable groups with some underlying diseases, they are prone to have severe symptoms. Therefore, our containment measures must pivot more towards prevention. And nucleic acid testing is one means of prevention. Prevention is the most economical and effective method. With effective, convenient, and high quality, nucleic acid testing is necessary. Thank you. Next question. From the cover, why do we say that the nucleic acid test is the golden standard of the diagnosis of the pandemic? So, will this nucleic acid test sensitivity be impacted by the variation of the virus? Is the available nucleic acid test still useful? Thank you for the questions. Nucleic acid test is mature internationally and is widely accepted. Previously, we cultured the virus for the test. We will have some observation under the telescope, and we will have some immunological experiments. But the culture of the virus takes a long time in the lab. Then, the nucleic acid test comes into being. It has high specificity. The specificity could be as high as 100% methodologically. That is to say, the result of the nucleic acid test will offer precise result as the culture of the virus in the lab. So it has gradually become the golden standard. And not just the COVID-19 virus. For the other viruses like the AIDS virus, we adopt the nucleic acid test as the method of diagnosis. You spoke about the variation of the virus. The nucleic acid test of the COVID-19 viruses is usually targeting at certain parts of the virus. Usually they will not be two omitted in the test simultaneously. And we believe that even with the variation of the virus, the nucleic acid test will have the same effect. For Delta and Omicron viruses, there have been some assessment results of the test worldwide, and they prove that the available nucleic acid test is able to test them. Thank you. Next question. From Hongxin News. In the reports of localities, we hear a lot about the positive sample from the environment. So my question is, does it mean that the environment in case is infectious? Mr. Xu, thank you for the question. If we test the positive sample in the environment, it doesn't mean that there is an active virus in that environment. If you want to do that determination, you have to separate the virus or the cell, and you can also test with the mice to determine the existence of the virus, be it the active or inactive virus in the environment. Let's take the COVID-19 virus as an example. The positive sample result doesn't equalize with the existence of an active virus. And the testing of the environment must pay special attention to the origin of the sample. If the sample is taken from the vaccination station, and usually in the vaccination, it's totally inactivated. That's why we say that we cannot throw the items randomly. And if you have a positive sample, it's usually from the inactivated nucleic acid test. But it cannot be taken as a regular positive case or an active virus. That is to say, to determine the positive case, you have to learn where is that sample coming from. You could interpret it as the existence of the nucleic acid of the vaccination, but as to the existence of the active virus, you have to judge by the origin of the sample. Next question. From CMG. Now we are in the stage of a regular containment in the low-risk areas. Is it necessary to maintain such regular nucleic acid tests? And in addition to the vulnerable posts, for the usual people, what is the reasonable frequency of nucleic acid test? And for the people who stay at home a lot, do they need to frequently take the test? Mr. He. Thank you for the questions. Right now, nationwide, we keep a low level of the infection. So at this stage, our testing facilities must be sensitive so as to have early discovery and treatment. Right now, how to achieve that? Nucleic acid test is still now the most scientific and effective means in low-risk areas and among the low-risk population. As you mentioned, for example, they stay at home people for a long time. For them, there is no need to have frequent nucleic acid test. Instead, the test must be oriented to the highly risky posts, the infected places, and the risky population. Thank you. Next question. According to some netizens, for different types of sample takers, they seem to have different sample taking procedures. Some may use the swab very hard, some have a soft hand, and some sample takers seem to be chewing gums when they are working on their post. Will these behaviors undermine the result of the sample taking? Mr. Li Ang. Thank you for the questions. According to the National Health Commission, for the sample taking, when the sample takers are taking samples with the throat swabs, the testees must open their mouths wide, and the sample takers will put the swab into the throat. And as we know, the throat is very soft. So when they are taking the sample, they need to use some strength to scrub with the swab. But at the same time, they must avoid damage. And the swab cannot touch any other places, for example, the lips or the face. Currently, the different testing facilities are adhering to scientific and standardized procedures. As to the factors influencing the result of sample takings, the first one is about the depth of the swab going into the mouth. Secondly, the time period of the contact with your throat. And thirdly, the height difference between the sample takers and the testees. And fourth, the coordination of the civilians. Anyway, we have to kindly remind our civilians, when you are participating in the nucleic acid test, please support and coordinate with the sample takers. In line with the local requirements, please regularly complete the whole procedure, including the movements and the gesture, so as to guarantee good testing results. Thank you. Next question. From People's Daily. According to some feedback, in some sample-taking stations, the line is very long, but in some stations, there were very few people, and some facilities seem to have very slow reporting process. So we must improve the convenience of nucleic acid test. How to do that? Madam Guo Yanhong. Thank you for the questions. To continuously optimize the nucleic acid test services and smooth away the procedures so that the civilians could enjoy convenient nucleic acid test services, we have worked on the following 4 measures. Firstly, reasonably set up the nucleic acid test points. We have a grid-based arrangement of the nucleic acid testing facilities. We consider, for example, transportation, the population distribution in our scientific arrangement of those stations. And we now center on the community-based nucleic acid test with a large number of population and frequent people flow with no traffic congestion. And at the same time, in some fixed testing stations, in addition, we also set up some makeshift testing stations so as to offer convenience to the civilians. And secondly, we must publish the testing results immediately. For example, through the WeChat applet, the official account, and so on. We will publish the results to the civilians instantly, so that the civilians will go to the nearest station to get the information. And also we are establishing some digital map and updating the information about the new stations. Third, a flexible arrangement of the time of sample taking. And we update the time periods immediately to the public. For example, for the people who go to work and the people who go to school, they can try to take the sample in the morning and in the night, and on the weekends they can receive the sample taking services all day long. So we try to offer flexible time choices for sample taking to the public. Fourth, timely feedback and reporting. Once the facilities complete the sample taking, certain authorities must share the results on their code so that the civilians can check the result of their nucleic acid test in time. Next question. Thank you. From the 21st century economy, in certain places, for those people who do not participate in the regular nucleic acid test, they have some penalty measures, for example, fines or mandatory requirement of the participation. So what measures can we do to avoid such mistakes? Mr. He Qinghua. Thank you for the question. Nucleic acid test has been the regular examination and testing means. As we said, it's the most scientific and effective means. For the infected places, they must fully consider the local containment situation and requirements to scientifically identify the targets of the test, the frequency of the test, and so on. They must also do a good publicity and education job. So here, we call upon the civilians to adhere to these policies and coordinate with the test requirements. That's their due responsibilities. And in that way, we can build a firewall of the prevention and control against the virus society-wide. And for the authorities or places who make the decision of mandatory test, the State Council requires certain respective authorities, people, or localities to hold themselves accountable and correct their behaviors immediately. And we also welcome the monitoring of our media groups. Next question. Recently, we've noticed that several nucleic acid testing facilities have been punished. So what is the threshold for those facilities, and what qualifications are required from those facilities in order to do their business? What is the usual procedure of their approval? Madam Guo Yanhong. Thank you for the questions. Right now, the medical institutions who serve the nucleic acid tests have three categories. Firstly, for example, hospitals and maternal and child care institutions. Secondly, this disease control institutions. For example, the CDC branches from the county level to the provincial level. Third, the medical experiment labs, which also is an integral part of medical institutions. We usually call them the third-party testing facilities. Since the third-party testing facilities are also medical institutions, their approval and management will be the same as the other types of medical institutions. We adhere to the medical institution management regulations and the other promulgated basic standards of the medical test. As to the approving authorities, they must be at least a municipal level and above. And their approval adhere to the usual procedure of medical institution approval. For example, the medical institution approval procedure, their facilities, their layout, their equipment, their rules and regulations will be checked and approved. Once they are qualified in those regards, they can be licensed. That is to say, that license represents that you can serve the medical services. It's like the access threshold. To acquire the medical institution license, the third-party facilities must also adhere to the verification requirements when they are offering those testing services. For example, if you want to carry out the nucleic acid test businesses, clinically, you must adhere to the examination lab requirements and the biological level 2 requirement and register themselves in certain health authorities. And the practitioners must be properly trained in order to do the testing work. Thank you. Next question.
谢谢南方都市报记者。此前的通报里面讲到，有几家检测机构
Southern Urban Daily.
10管1的核酸样本，采用多。
There used to be reports about the mixed tube test and the artificial dilution of the sample by certain testing facilities. So what can we do to avoid that in the future? Mr. Lee. As we know, usually we have the practice of mixed sample taking. We have theoretical and lab verification and on-site verification. And we found no significant difference between the mixture of the agents in the tube and the independent tube individually in terms of the accuracy. But when we mix the different samples together in one tube, there may be the dilution. If without the verification either in the lab or on the site, we cannot prove that the accuracy or detectable rate of the mixed agents will be the same as the standalone tubes. So we would love to refer the question to Mr. Liang. Thank you, Jingming. Speaking of the supervision, as we know not long ago, in Beijing, in our supervision, certain testing facilities have acted illegally through the illegal mixture of the tubes. leading to the artificial dilution of the samples. That adds more risks to pollution and omission of the test, influencing the result of the test. More importantly, it hurts the overall containment measures. So, we have zero tolerance for such behavior. We crack down upon every case, and the facilities have been suspended their business. The certain people are already referred to the public security bureaus for more examination. We have taken multiple measures to enhance our supervision of the nucleic acid testing facilities. Firstly, access. Municipal and district level health-related authorities adhere to the stringent measures when it regards to the access management of those facilities. The health commissions and authorities, if issue a qualification certificate to the facilities, they must then ask the experts to have on-site delivery. With the approval on-site, those facilities can carry out their businesses. Secondly, regular management. The Municipal Clinical Trial Center has certain requirements and performance evaluation of those facilities. If they found them illegal or unqualified, they will not be able to carry out their businesses. And according to the national requirements, we have also set up the third-party nucleic acid test facility monthly evaluation. Different districts will organize experts to check all the facilities' work in terms of their legality and their quality of work. For the qualified facilities, they will notify them in public. Otherwise, they will be urged to enhance their quality management, and they must do a good job in quality control to guarantee people's safety. State Council Beijing team has also dispatched experts to compile the new requirements for daily monitoring work of those facilities. Thank you. Next question. From China.net. Since the outbreak of the pandemic, nucleic acid test is known for all. And has this test been carried out before the COVID-19 outbreak? And what is this method usually used? Mr. Xu Wenbo. This technology includes a lot of varieties. For example, the hybrid technology and the isothermy technology and the PCR technology. The PCR technology is most commonly known. Now, we are receiving the nucleic acid test through the Florence PCR test. For some special virus and bacteria, in the early days, we must get their gene sequencing in order to develop the PCR test agents with high specificity and sensitivity targeting at that specific virus. For the facilities, this PCR test is an effective technical means to diagnose the virus. Actually, the nucleic acid test has 10 years of development history in China. The equipment and the agents are already independently developed in China. And they are widely used for measles and the influenza, AIDS, type B, hepatitis. And right now, among the 40 statutory infectious diseases, their pathogens can be tested through the nucleic acid tests. In addition, the Florence PCR technique has also been used in oncology and the other non-infectious disease sectors.
谢谢。
Thank you.
好，谢谢，请继续提问。好，来
Next
请右
question.
侧区第3排第2位穿深蓝色衣服的记者。
谢谢主持人，我是凤凰卫视记者。
From the Phoenix
目
TV.
前快检、混检被普遍的采用，那
Now
请
the
问这
quick
是否会
test
降低核酸检测的
and
准
the
确性？
mixed
另外
test
核酸
are
检测
widely
也存
used.
在一些
Well,
假
those
阳性、假
methods
阴性。
influence the
那请问
result,
这些
and
原
there
因
have
是
been
什么
some
是否
false
有可能
positive
能
and
避
false
免
negative
还有
results.
就
What
是
are the
对于
reasons
新
for
冠病
those
毒阳性
phenomena
复
and
检
how
的
to
流程
avoid
应该发
that?
挥怎样的作用？谢谢。
And for the confirmatory
好，
test
我们请
of
李
the
金明先生来
positive
回答这个问题。
result,
好，
what
感谢记者
role
的提问。
is the confirmatory
关于
test
这个
playing?
快检啊，
Speaking of
快
the
检
fast
试检
test,
可以分为2类，
there are two types
那么
of
一类
the
是低通
its
也
reagents.
就是我们每一次检测
The
可以
first
检测
type
1个
means
到
for
16
every
个样
test
本。
we can test
那么主要是
1
用
to
于
16
发热风
samples,
险的患者，
usually in the
还有
fever clinics or
那么
the
它需要的时间呢是30到60
emergency
分钟
rooms,
还有一
and
个
it
呢，就是我
requires
们一次
30
检测
to
可以
50
检测
minutes
90个
time.
样本，
And the other
可以用
type
这个
is
规律筛
about
查，它的这个
the
检测流程
wider
也就
coverage
在
of the
过程里
test.
头大约也会快30分钟。
It can also save another 30 minutes.
那么从这
It
个
expedites
我们只要
the
严格按
testing
规范
process as long
包括
as
我
we
们
have
所讲的
rigid control
这个
and
快检
requirement.
都是没有问题。
The quick test is
那
surely
么还有一个刚
effective.
刚提到这个
And you
一
also
些假阴
mentioned
性的
about
问
the
题
false positive
其实
and
关于
false
假阴性
negative
应该有3个
phenomenon.
方面问题。
There are 3
那么
problems
一个呢
about
是
it.
我采样的这个时
First,
间，
the
比
time
如
of
说
sample
这个
taking.
患者
For example,
这个很早感染以后他
the
很
patient has
很
been
早就在
infected
他的医
earlier,
没有这个病毒复制的这个浓度，没有
and
达到我检测方法的这
the
个检测
density
性
of the virus in his or her throat
那么还有一个
has not
这个感
met
染时
the
间太长
criteria of
比如说
our
50
test.
半
And
个月
secondly, he or
3
she
个月
has
那
been
么这个时候
infected
呢
for
如
too
果
long.
超过这么长时
It's
间
already
呢
been 10
它
to
就进入
15
恢复
days,
状态了
and this person is already recovering
所以
from the
检测这个
infection.
阳性检出的可能
He
性
or she
大大
may
地会降低
already have the
那么第二个
antibody,
方面的问题
so
就是
the
采样
result
工作
of the nucleic acid test may not be completely accurate.
哎我采样
Third,
操作
The
好的没有
control
到位
process,
没有
for
采样过
example,
的样
irregular
还
sample
有呢
taking
我采完样
procedure,
以后我放在哪里包括
and
运输之前放在哪里
where did
如
you
果
put
这
the
个地方
samples?
像夏天它就不会
How
很
to
不
store
稳定
it, especially in
那么这个
summertime,
样本
how
到
to
了实验
transport
室
it.
以后这个我们实验室的检测
Once the
比如说
sample arrives in the
我的
lab,
院严
for
格
the
的
lab,
监控
it's
我
also
的试剂
challenging.
我的仪器
Your
该备好
equipment,
啊包括我的
is it
原材料
compatible
方面是不是
with
遵守
the
相关的严格的流
reagent?
程
and
那么
do
这个
all of your staff members
也
adhere
是
to the most
到这个
stringent
假阴性
procedures
的
of the
因素
test in the lab?
那么第
Those
三
may
一个
also
是
lead
素质造假
to the
啊
false
那么
result.
违
Third,
法违规那么其实我们这个第三方面的
Artificial
实验室
illegal
那么
behaviors.
很多虚报
For
自己
some
检测
third-party
能力
facilities,
那么
some
超
of
出自己的
them
能力啊去揽受这个样本
bluff about their
那么这个样
capacities
本
of
就是
test.
它不能够在规定时间里
Within
去完
required
成
time
检测
period, those
于是呢，
facilities
就是
are
这些数字造假
unable to complete the
谎报假
test, so they
那
report
那
false
这
numbers.
个呢像这种情况呢那就要应该是
For
这
this
个违法
case,
违规的
their
还有一些
behaviors
实验
are
室
illegal.
它通过什么把这样本再混合
Some labs
这个检测量
mix the samples
导致这个
together
失真
to reduce
那么
the
关于
cost
假阳性的
of
问题
materials,
那么主要有2个方面
and that leads to false negative result. As to false positive,
那么困
there
在
might
哪里
be
什么是
the
我们是大
pollution.
规模的人群筛查
Now we are carrying out a large number of all
也
mass
就是说我
tests
们每一批次之间
between
可能我们
two
就
different
用
batches
时间
of the
为实验
samples.
室做一些清洁
We may not have
在
enough
当然
time
我们
to
还用
clean
它
the
的密封
labs.
性不是说每一个
And
做出来都是很密封如果刚好我们碰到一个阳性
Some
的
of the
或者是我
tubes
们
may not be
取出
fully
样本
contained.
它的这个密封性有问题就会发生
If
泄漏
there is any
然后呢就会造成
containment issue with the
实验室污
tube
染
containing
造成
a positive virus, that may lead to the
或者
pollution
是
of the
带
whole
有
lab,
阳性这样一个假阳性结果那么
leading
第
to the
二方
false
面
positive results
标
of
准
the
就是
other
交叉
tubes.
的
And
那么第二
third,
个交叉的
cross-infection.
这个样本
That is to
这个
say,
样本之间呢我有比如说我这里有
between
阳性
samples. For example,
当然我
today,
们在预期发生的
we
时候
have a
我们的阳性
positive sample.
阳性样本少那么如果预期的阳性样本比较多的时候如果发现
Once
一
you
个
have a
这
lot
些
of
交叉的
such
再加样本
positive samples, there may be cross-infection,
会拖泥带水
especially
或
when
者
you're
是让人
adding
疲劳
in
就
the
造成这个
samples
交叉污染那么还有一
in
个
a very long
就是
time.
那么也
That
可能
prolongment
这个
may
软
lead
体
to cross infection.
也可能造成这个假阳性结果。
leading to the false positive results. Another example is in the labs. The suspicious positive result is taken as the definitive positive result, and it's reported. And in the verification, it was proved to be a false positive. For all of those problems I just mentioned, some are inevitable, but for some others, it's an issue of quality control, and we must improve our work. Some are illegal behaviors and criminal behaviors. We must take tough measures against them. Thank you.
好，谢谢，请继续。
Next question.
好，先来请右侧区第二排靠里边这位男记者。
谢谢主持人。光明日报记者提问。
From
我的
Guangming
问题是：
Daily.
近期核酸检测采样棉签还有荧光剂，同
For
样
the
被
swabs
致癌物
and the
成分引发
fluorescence
广泛关注。也有公众反映
have
核酸后
seen
恶心
some
的感觉比较强烈，怀疑
infections,
其中有一些
and
刺激
some
物
civilians
会对身
say
体
that
造
they are
成严重的
vomiting
伤害。
after
请
the
问这些
sample
传
taking.
言是真的吗？
Will
谢
those
谢。
be damaging
好
to
我们
people's
继续
health?
请
Are
金
those
明先生
rumors?
来回答这个
Mr. Li Jingming.
感谢记者提问。那么这个采样试纸啊，你看起来像棉签，但是呢，它
We
不
know
是
that
它的这个材质是那个
the
聚酯
sample
或者是医用这样
taking
的性质
items look
它
like
跟我们日常
swabs,
生活中那个牙刷
but actually they are
有点类
different.
似。牙刷的那
They are
个
quite
刷
similar
毛
to
它
the
也是
toothbrush.
那个仪容的，但是呢，我们那个制容
The
试纸
material of the
就在做的
toothbrush
时候
is similar
是
to the
成百万
swabs.
个微小的那个制容试纸
We have millions of
附着在那个
those
试纸的那个
materials
顶端上面。
adhering to the
那这个
top
呢，就是
of
我
the
们采
swab.
样的时候，就像是牙刷我们刷牙嘛，
It's just
但它
like
那个就
brushing
刷我
our
们那个
teeth.
口腔里
The
面
swab
咽
is
咽喉部
brushing
或者是
the
我们那个扁桃体
end
去
part
刷
of
出来
our throat
那么刷的话呢，就会取得这个细胞，
or
我们再把这个试纸
our
放在
tongue
采样管
cells,
里面去，
and then we
因为它
put
是材质
it
是仪容嘛，它是聚酯
into our tube.
所以这个细胞就很容易脱了这个这个保存液里面，那
And
么
the
就用到
cells
后
will
面
fall
相
into
关的检测。
the liquids
那么至于
for
刚刚
test.
谈到这个采样的这个恶心的问题，
You just
这个
mentioned about the
引起刺激的
vomiting
问题
response.
那么其实呢，就是我们把这个采样试纸啊，安全性的问题啊，这个采样试纸啊，它是一个属于医疗器械，
The
那么
swabs
它的生
belong
产
to the
环境
medical
这
equipment.
个要求
The
是非
production
常严格
environment is very
包括它有
stringent
这
for the
个还有
swabs,
的质量的监管也有相关
and
的要
there
求。
are certain criteria
我
for
们
their
的产品
quality
这个
supervision.
医疗器械的产品，它最基本的要求就是无
The
毒、
basic
无毒无
requirement
害。
is
再
non-toxic
一个呢，就是
and
这个制容这
non-hazardous,
个试纸啊，生产过程中间，它也不会
and the
产生
production process of the swabs will not
那
deliver
么至于
any
是采样过程中
hazardous
间，比如说
particles.
它有不适感，
If
比
you
如
feel
说这个恶
uncomfortable
心的感
after the
觉
sample taking, for example, vomiting,
这个不同的人啊，
it's
它的反
stimulating,
应
of
不一
course,
样
but different
比
people
如
have
说有
different
的人
response.
他的咽部它比较敏感，
Some people
敏
have
感的就是
very
说它采
sensitive
样以后觉得不
throats,
舒服。
so after the sample
那么
taking,
那
they
有的人
feel
可能容
uncomfortable.
忍性就会大
For
一些
others, they are more
所以我们在
tolerable.
采样的时候呢，怎么采呢？
So we
它
must
是在
be
那个咽喉
careful
的
with the
上方
sample taking.
挂着有的人对这个试纸啊，它的有韧度也不一样。
You're
那
scraping
么
your
就是说
throats,
这个试纸呢，有的人就刺
and
激
when
一
you're
定
scraping,
啊，这个试
some
纸这个
people
刺激呢，
feel
它就会
very
产生这
uncomfortable
种痒感，
with the
或者是
swabs
呢
in
就
their
是
throats,
这个
and some
呕
people will
呕
certainly
的这
feel
种感
nausea.
觉。所以这个是个体的差异啊，应该是比较大的。那么还有一种情况呢，就我们在采样的时候啊，通常
And
这个
in
降解
addition,
那么降解
when
有的
we
人呢
are
就那个
having our
前腕
samples
那个软
taken,
弱
we open
就
our
把那个
mouths.
舌根合在一起了。那么这个采样的人呢，他想把这个保证这个采
And
样
the
的质
sample
量，
taker wants to
他就
guarantee the
往里头
quality
探
of
他要找这个
the
咽喉壁
test.
啊，那
So
个扁桃
they
体。
put the swab
探的
very
时候
deep
它就
into your
刺激
throat.
所以有的
It's
人
of
呢，他
course
自己反应
stimulating.
非常非常强烈，
Some people have
出现
very
那个
strong
口渴
response.
但是呢，
That's
如
why
果
they're
我们采
vomiting
样
or coughing.
一旦采样完成以后，它就很容易去缓解，
But
所以说
it's
采样
easy to
对我们的
recover,
这个个体啊没有伤害。
and it's not harmful for the
好，
individuals.
谢谢，请继续提问。
Next question
好，先来请左侧区第一排第3位，新华社记者。
from Xinhua News Agency.
谢谢主持人，我是新华社记者。请问核酸检测采样人员需要具备什么样的资质条件？
What are the
我们注意
qualifications
到北京市
required
现在
for
是
those
面向
sample
全社会
takers?
招募核酸
Beijing is
采
now
样的志愿者
hiring the
请问
volunteers
怎样
to
保障
conduct
他
the
们
nucleic
开展
acid
这个
testing.
采样 规范性和准确
So
性
how to
这个方
guarantee
向
the
谢谢
accuracy?
好，关
of
于
their
采
work.
样人员的资质和条件呢，我们请郭艳
We
红女
refer the
士
question to
来
Madam
回
Guo
答。那
Yanhong
么关于北京的有关情况呢，
as
我们
to
请
the
李昂主任做。
qualifications, but
好，
as
先
to
请郭
the
艳红女士
situation in Beijing, we
来回答。
will
谢
deliver
谢
the
这位记
question
者
to
提
Liang.
问。我们知道
First,
采样
Madam
啊
Guo.
是
Thank you for the
核酸检
question.
测过程当
We know
中
that
的重要的环节之一，
sample
因
taking
此它的
procedure
质
is an
量啊
important
刚才这
stage
名
and
也
step
讲了，
of
直
the
接
nucleic
关系
acid
到我们整
test,
个核酸
and
检测的质
the
量。
qualifications
而
of
呢，采样
those
这个过
practitioners
程
matter
呢
the
规
most
范
to
管理
the
是非常
quality
重
of
要
our
的。
sample
那
taking
么对于
result.
人员的要
And
求，
the
按照我
standardized
们现在
management
的
of
规
those
定，
practitioners
这
is
个核酸采样的
also
人员呢，
paramount.
首
According to
先
the
啊，应该
current
具
requirements,
备
the sample
卫生
takers
相
must
关专业
firstly
技术资格。
acquire
那这里
the
边不仅
certificates
仅
of
是
the
我们的医
health
生、护
related
士，也包
businesses.
括了药师、
That means
医
they refer
技
to
啊
not only the
等各类
doctors,
人员。
nurses, but
那
also
么
the
其次呢，就是要
pharmacists
经过
and
卫
so
生健
on.
康
And
培训
secondly,
部门的
they
这
must
个
be
培训
approved and
培训考核
trained
以
by
后，
the
才能够
health
从事
related
核酸采样
authorities.
工作。在从事核酸采样工作当中，
In
要
their
按照我
practices,
们已经制定的
They must
医疗机
adhere
构
to
新冠
the
病毒核酸检测
formulated
的工作手册。这个工
manuals
作手册
of
当中
nucleic
希
acid
望
test.
对采样的
The
人
manual
员要求，
has
包
certain
括一些相关的
requirements
规范
of
都有明
the
确规定，
practitioners.
包括采样的部位
For example,
如
the
何
position
操
of
作它
the
这些呢
sample
都应当按照
taking
规范来进行。
and
那么通过
the
开展采样人员的
procedures
培
of the
训，要
sample
使得我们
taking.
采样人员呢
And with the training of the practitioners, those sample takers will have a very proficient grasp of the method of sample taking, including nasal and oral sample taking. And also they must be able
来
to
保证采样的
adhere
这
to
个
the
质量。
requirements of biosafety and self-protection. Mr. Liang, please add something. According to Madam Guo, we learn what are the qualifications of the sample takers, and as to Beijing specifically, to improve the capacity of sample taking since May the 24th, we publicly hire the volunteers of nucleic acid test, and they can be the medical practitioners who are retired, or the doctors working on campuses, or people who have the background of medical education. And to guarantee the accuracy of their practices, we have done the following. Firstly, we ask the industrial associations to make certain PPTs or the videos for training, and also some examinations and scoring tables and standards. And secondly, they categorize the training. For volunteers, their training is based on 2 levels, for example, the district level and municipal level. And the associations and the district level health authorities will be responsible for the stratified training of those volunteers. Third, without training, they will not go on the post. If disqualified, they will not go on post. For the people who have completed the training, there will be evaluation with both theoretical examination and practical examination. Once they pass the exams, they will be serving as the qualified sample takers, and they will be put in Beijing level nucleic acid test pool of resources. 3,028 people are qualified right now, and 786 people are already serving on the posts in Beijing.
我们现在
Thank
请
you.
一个
Next
核心
question.
第4排第3位穿橙色衣服的记者。
谢谢主持人。澳门月刊、澳门新闻通讯社记者提问：
Thank
为什么
you.
有些患者
From
连续
the
多次核
Macau
酸检
Monthly.
测都是阴
For
性
some patients, they have taken the test several times with the results as negative, but then they turn out to be a
好，我们
positive
请
case. Why
李
is
金
so?
明先生来回
Mr.
答
Li
这个。
Jingming.
好，刚刚谢谢记者提问。刚刚你提到的那个核酸检测连续多次阴性，
The
那么最后出现阳性，
multiple
这个就
false
是在我们绝
negative
大部分
results
它是不会有的，但也有发生过。
do not
应
happen
该
a
是
lot.
这样3种情况。
And there are
第一种情
3
况呢，就是
scenarios.
这个人一开始是没有。
First, this
那么
person
是在后
in
面
case
某一个时间
was
点
not
才
infected
感
in
染
the first place,
那么
and
这个时候感染了以后
he or
就是
she
阳性。那么还有
was
呢，
infected
就是说
afterwards.
最早这个
Second,
潜伏期的时候，那么我
in
们
the
这个
early
检
days,
测检
he
测
or
没检
she
测出来，
was in
那
the
么一发
probation
病以后
period.
就检测是阳性。
That's why we
那么
failed
第三个
to
方面
test
就
it
是
out.
前面提到的那个
Third,
就是我们
as I
一开始
mentioned
的时候
before,
那么这个病毒
in
的
the
量
beginning
尽管它
the
能够
volume
有了，但这样呢
of the
达不到我们
virus
出的这 这个检测的下限。那么
did
这个
not
时候
meet
也这么
the
情况下
threshold of
愿意
our
再来
testing
一高的话呢
capabilities.
就检测会成阳性。
When the volume
就这样
of the
一个情况
virus
谢谢。
grows gradually,
好，谢谢，请
we
继续
can
提问
test it out.
好，来请左
Thank you.
侧
Next
区
question.
第二排最靠里边这位男记者。
谢谢主持人。健康报提问，核酸
From
检测机构
Health
的条
newspaper,
件和能力直接
The
影响
capacity
到
and
样本的检测
qualification
质量。
of the testing
请问国家
facility
采
have a
取哪些手
direct
段来
influence
加
over the
强
result
核
of the
酸检
nucleic
测
acid
全链
test.
条的监
So
管，
what will
从
be
而
the
确保
supervision
核酸
measures
结
taken
果的准确
towards
性。
those facilities in order to guarantee the
好，我们
accuracy of
请
the
郭
nucleic
艳红
acid
女士
test?
来回答这个问
Madam
题。
Guo Yinhong will take
好，
the
谢谢这位
question.
记者的提问。就确实啊，这核酸检测
Indeed,
机构的条件和能
The
力是非
conditions
常
and
重
the
要的，也是呢我
capacities
们
of
保
the
证核酸
nucleic
检
acid
测
testing
质量的
facilities
这样一个
are
管理
very
的重点。
important, and
那
they
么我
are
们都
the
知道核酸
priority
检
of
测
our
呢，它是一
quality
项
control.
成熟
We
的
know
实验室的
that
检测
the
技术。
nucleic
在
acid test is a
2010
mature
年的时候呢，我们
lab-based
国家就已
testing
经颁
method.
布实施了临床
Years
实验
ago,
室
China
管理
has published
以及呢
the clinical
临床
trial
基因
lab
扩增检
management
管理的相
and
关
the
办法。
the
对呢
gene
开展核酸检测的机
magnification
构、
management
实
method.
验室、人
As to
员
the
都
nucleic
进
acid
行了
test
一系列的
facilities,
规定。在这部
practitioners,
分
we
上
have also
那么
some
新冠肺炎疫
paper
情发生以后
requirements.
呢，应该说这个核酸检测工作啊得到了
With the
普遍
outbreak
的开
of the
展，
COVID-19,
因此我
nucleic
们进
acid
一步
test
加强了
is
核酸
widely
检测
taken.
机构的监管。从
That's why
这个
we
审
have
批制
reinforced
准
our
入
supervision of the
指
facility,
控
starting
指
from the
评
access
日常监
threshold
管
to the
以及呢
daily
这个
supervision
惩罚退出等
and
全流
the
程都呢
penalties
进行了
and
相关的规定。
exit
那么
of
在
the
审批
market.
准入
We
方
have
面，刚才其实
detailed
已经介绍
requirements.
了，就是我们要求地方卫生健
As
康
to
组织部
approval,
门
I've already done
对
the
每一
introduction.
家开展核
The
酸检
health
测的医
authorities
疗卫生机构
must
要实行准入的
have
监
the
管，
access
严格检
control
测
of
的
every
资质的
testing
审批
facility.
管理，
They
确
have
保
very
呢检测
stringent
机构、
approval
实验
process
室
to guarantee that the
人员
labs,
都
practitioners,
具
and the
备
testing
合法的
facilities
资质。
are qualified
那么
and
在指
legal.
评指控方面应该说从几个
As
方
to
面
the
来进行
assessment,
相关的指评和指控工作。
there are the
一是
following
呢，常
measures.
态化我们开
First,
展实
regular
验室的
lab
室内的这个
indoors
指控工作，要求呢
assessment
实验室
will
每
require
一
the
批
labs
次上机核酸检测的
to
过程当中，都要放入阴
put
性
in
和阳
the
性的
negative
指控品，
and
与呢真实的
positive
标准呢
samples
一起来
together
检测，来
and
保障
test
检
the
测结
real
果的
samples
真实和准
together
确。
to guarantee
第二
the
呢，就是进
accuracy
行时间指
of the
评。
test.
那么我们
Second,
通过组织国家和省
we
级的
organize
专
the
门的
national
这
and
个
provincial level
机构来定期
organizations
开展呢
to
时间的指评。
regularly
像在国家
have
层面，我们每
assessment
月
and
由
monitoring.
国家临检中心
Every month,
对呢相关的实验室
the
进
national
行
level
时间指评。
authorities
像
will
呢实
have
验
the
室呢
external quality
发放
assessment
刚才这
of
个
the labs.
梁主任也特别介绍到了，就是
As
向每
Mr.
个实
Liang
验室
said,
发放盲样，也
there
就是
will be
我
some
们的标
blind
准化检
samples.
测样本，来对实验室
That
进
is
行考试
the
考核。
standardized
那么
samples
检验
to
它
assess
检测
those
结果
labs
的准确性。所以
externally.
这个时间指评
So,
不仅仅从国
the
家层面
external
层面
quality
来开展
assessment is carried out
省里
not
面
only
也
at
得
national
相应的
level
专
but
业机
also
构
provincial
也
level
要开展
with the
这样的
help
一个
of
时间指
professional
评。
institutions.
第三呢，就是在大
Third,
规模核酸
The
筛查的
mass
过程
in
当
the
中，
process of
我们
massive
对每
nucleic
一家
acid test,
承担检测任务
every
的实验室
responsible
都要派
testing
驻
lab
检测专家
will
作为呢质
receive
量的监督
an
员，
expert
来
as
全
the
程的
monitor
监督
person
指导
of the quality.
实验室的检测
This
工作。
person will
同时呢，
be
在
in
检测
charge
工作的指导
of
过
the
程当
monitor
中，
and
还
guidance
特
work.
别要通过
And in the
分析
process, they
检
must
测
also
试剂的
analyze
内参数据，
the
查看呢
parameters
是
and
否
data
采集到细胞，来反映
to
采
check, for
样
example,
环节
if
的
they
质
have
量。
already acquired
所
the
以这是在
cells
呢指控指评方面。
and
那么
adhere to the
在
quality
日常监管
requirements.
方面，
As
我
to
们通过
daily
呢加大
monitoring,
呢对医疗机构的校验，
we step up
因
the
为我们按照
verification
这
of
个
the
医疗机
medical
构管理条例和
institutions.
实施细则的规定，
According to the
要
laws
对呢
and
医疗机构
regulations,
进行定期的校
we
验。
must have
在校验的基
regular
础上呢，
verification
采
of
取
the
呢
medical
飞行检查、
institutions. For
随
example,
机
there might
抽
be
查
spot
的方
check
式来看我们的检测
and
机构
random random
是否落实了我们相关的
examination
制度，
to see
特
if the
别是
medical
主控的措
institutions
施
have
是否落
implemented
实。
measures,
同时呢，卫生健康
especially
行
in
政部门
terms of
还要
quality
定
control.
期组织核
And
酸
the
检测
health
机构
authorities
来
must
参加
regularly
我们的
organize
实
the
评，
facilities to
并加密
participate in our
实评
external
的
quality
频次。
assessment,
其中呢，
and
对
the
于呢一
frequency
些实
will be
验室
increased.
要实行每
For the
月的
labs, there
审
must
核
be
制度，
monthly
加大呢
evaluation.
监管的力度。那么在惩罚 和退出方面，
As to
通过
punishment
我
and
们
exit,
日常的检查、校验，
with our
根据
daily
呢不同的
examination,
违规情形，
for
要求
different
呢我们地
scenarios
方的
of
卫生行
illegal
动部门
behaviors,
要给予
we
相应
require
的处罚措
local
施，比如说包括警
authorities to
告啊、
punish
通
them,
报
for
批令
example,
啊，
warning,
直至呢取
reporting,
消核酸检测的资质，
and
或者是吊
cancellation
销
of
医疗卫生机构、
their
医疗机构的这些许可证。那么
approval
对于
or
呢
license.
涉嫌违法犯罪的，依
For the
法
criminal
移
behaviors
送公安机关追
or
究呢
illegal
相关的法律
behaviors,
责
we
任。
refer the people
那么
to
近
the
期
public
为
security
了进一步
bureaus
加强新
Recently,
冠病毒核酸检测全链条的监
to
管，
further
国务
monitor
院联
the
邦联
whole
盟经济
chain
综合
of
组
nucleic
也
acid
专
test.
门做
State
出
Council
了这个工作
Joint
部署，
Prevention and Control
从
Team
呢
has
6个
done
方
some
面
arrangements.
进一步加大呢监管的力度。
Specifically, there are 6 measures.
一是
First,
严格检测机构
have
和人员的资质管理
stringent management of the
二是规范样
qualifications
本的
of the
采
people
集
and the
保存
organizations.
和
Second,
转
the
运的
sample
管理
taking,
三是
storage,
强
and
化核
transportation
酸检测机
management.
构的
Third,
日常监督管
the
理。
daily-based
四是
monitoring
加强
management of
应
the
急
facilities.
状态下
Fourth,
核酸检测机构的监管。
the facility
五是呢提
monitoring
升核酸
emergency
检测
scenarios.
资源
Fifth,
的利用的效
the
能。
assessment
6
of
是
resource
严格落实核酸
utilization
检测机构的
effectiveness
退出机制，
and
特别是对
stringent
核酸检测
exit
机构，
mechanism,
我们设立了
especially for the
红
nucleic
绿
acid
灯制
testing facilities. We
在
have a
依法
policy
准
called
入
the
对
traffic
符合
light
条
system.
件的举办主体
For the
进
qualified
行绿灯
entities,
审批的
we
同
will have a
时，
green light
坚决
approval
落实
system.
黄
But
灯
in the
的整改
meantime, there will be
以
the
及
yellow
红灯
light
的
rectification
来
mechanism
呢加
and the
大
red
这
light
个监管的
exit
力度，
system
来确保
to
核
step
酸
up
检测的
our
质量。
monitoring
谢谢。
and to guarantee the quality
好，
of
谢
the
谢，
nucleic acid
请继
test.
续提问。
Next question.
好，先来请左侧区第2排第3位女记者。
谢谢主持人。新京报提问，近期是有个别的那个核酸检测机构
From Beijing
因为
News,
违法违规操作，所以
some
被立案调查了。
certain
我们想问一
testing
下，卫生
facilities
健康部门对于这种核
have
酸检测
been
机构的飞行检查
illegal.
是怎么
So
展开的？然后包括哪一些内
how
容？包
do
括
we
目前有没有一
assess
些进展？
those
谢谢。
testing
好，
facilities?
前一阶
For
段
example, what
北
is the
京公布
procedure
的
of
有
the
关
flight
飞行
check?
检查的一些
What are
情况，
the
我们
progress
请
made?
李阳先生来
Mr.
介绍
Li Yang
有关工作。请。
好，谢谢这位记者的提问。
Thank
那
you
么
for
为
the
了提
question.
高对核酸检测机构监督检查
To
的针
improve
对性和时效性，
the
我们建立了
targetedness
市
and
区
the
2级的
timeliness
质量
of
安
our
全
check of
监
those
督工作
facilities.
机制。
At
那么市区2级的卫生健康
municipal
部门
and
组织了
district level,
卫生监
we
督
have done
员
the
以
following.
及
For example,
检验、
they
院
have
长、
dispatched
疾控
the
等方面的专家
monitoring
开展
person
不定期的
and
抽
the
查
experts
和
to
专
have
项检查。
some
那么为了提
specific
高检查的效率
checks
和成效，我们制定了
as
重点监
to
管
the
指标，
effectiveness of
建
the
立了
check.
管
We
理
have
的
set
台
up a
账，
series of
对成立
indicators
时间比较
and
短、
logs
质量问题比较
for
多、
some
信
shortly
息系统监
established
测数据
facilities
出现异常
and
的
the
检测机构，
facilities with the
从人员的资质、
information
资
errors
配置、样本
as
采
to
集
their
与管
sample
理、
taking
实验室资
management,
质、
their
环境
lab
设施、
qualification,
检测流
environment
程
and
的管理、
equipment,
实验室生物安全等方
their
面
biological
进行飞行
safety.
检查
We will
和
carry out
重
the
点辅
flight
导。
check.
那么检查以后呢，会根据机
After
构
the
存在
check,
的不同的问题，
Based on the different
分级
problems
分
of the
类
testing
予以处
facilities,
置。
we will
北
categorize
京本
them
轮疫情以来，
and
我们
handle
组
them
织了多
properly.
轮针对
In
实验
Beijing,
室
we
质量安
have
全的
organized
飞行
several
检查，
rounds of
特
flight
别对于
checks,
实验室是否
especially
存在出
as
具
to whether
虚
the
假的
labs
报
have
告、
some false
违规进
reports
行多管
or
混检等问题，
illegal mixture
进
of the
行了
tubes.
重点的检查。那么近2周，
In recent
市
2
区
weeks,
卫生健康行
municipal
政
and
部门
district
对
level
第三方检
authorities
测
have done some
实验
flight
室
checks of the
共开展
third-party
了督导检
facilities.
查
In total,
622家次。那
we
么
have
刚才杨副
covered
局长也说到了，如果我们
622 such
发现了
facilities.
其中的一些问题，我们将
As
依
Madam
据
Guo
问题的
mentioned,
轻
if we
重
discover the
轻重
problems
予以
based
吊
on
销
the
医疗机
severity
构
of the
执业许可
problems,
证，取
we may
消核
cancel
酸
their
检测资
license
质，暂
or
停
their
服务整改
qualification
等
of
处置措
nucleic
施，
acid test
并
or
及时
suspension of their
向社会
services,
通报。
and we
那
will
么下一
publish the
步，
list
我
of
们还将持续
their
地加强
names
核酸检
immediately
测
to the
机构的
public.
监
In the
管，
next step, we will
确保
continue to
质量安全。
reinforce
谢谢。
our check of those
好，
testing
谢谢。
facilities to guarantee the quality of the nucleic acid test. I see that our reporters are highly concerned with the nucleic acid test. You have a lot of questions about it, but in the interest of time, we allow only the last 2 questions.
谢谢主持人，澎湃新
Thank
闻
you
记
from
者
the
提问
people.。
那我们都知道核酸
As we
检测
know,
的采样部分 部位有很多，比如
There are
说
several
咽拭
positions
子、鼻拭子、肛拭子等等。那
for
么
the
请问不
sample
同采
taking.
样部位的检测
The
阳
oral and
性
nasal
成功率是否
are
不
two
一样？
choices.
我国为什么要采用咽
Do
拭
they
子
have
呢？
a
谢谢。
similar success ratio?
好，
Why
这个问题
do
我们
China
来请
adopt
李金明先生回答。
the
好
throat as the
感谢这个
position
技术
of the
提问。
test?
那么你刚刚
Li
提的这个
Jingming
样
will
本
take
里
the
面，
question.
其实我
Thank you for
们
the question.
这个样本有下颌这个样本，像痰，那么有
Of
上
course
颌这个样本，像我们的鼻咽拭子、
The
口咽拭
sample
子。
taking
当然了，这个
is
肛拭
varied.
子啊，那么属于比较晚一点的。那么在这4种这个样本里头呢，痰它的那个病毒的含量最高。
As we know, usually the virus load is
像
the
其次的是鼻咽
highest
拭子，再就是
in the
口咽拭
throat,
子。那么作为新冠病毒的感染者，他早期的时候以
especially in the
干咳
phlegm.
那么痰呢，
And
它
the
不是特点。
COVID-19 patients usually have early symptoms of
鼻
coffee.
咽拭子的采集呢，对采样人员的操作的水平要求很
Also,
高，采样过程慢，
the nasal
尽管它
position
能
of
够
sample
这
taking
个
is
检出
more
的这个
demanding of the
这个
practitioners,
阳性率啊高于
and
口咽
it
拭子。
takes a longer
但是
time.
呢，一般不去
Even though
用
the
这个
success
大规
ratio
模的
is a
筛
little
采
bit higher
但是可以
than
用
the
这个
throat swab,
隔离人群的这个采样。
it can be
那么口
used
咽拭子呢，
among the
它的采
isolated
样比较
people,
简
but
单，
not on a massive
那么
scale.
采样速度快，
And
所以
for
在
the
大规模人
throat
群筛
sample
采的时候，
taking,
我们一
it
般的
can be
采
done
用
very
口咽拭
quickly.
子，
That's
尽管它
why
的检出
for the
率
masses, we
不如鼻
usually
咽拭子。那么作为
prone
肛拭
to
子来
take the
说呢，
samples from their
我们不
throats.
推荐，因为考虑这个被采者他的不适感，
Also, we
还有
have to
肛拭
consider
子
the
的
comfort
低阳性
level,
检出率，不推荐采用肛拭子采样。谢谢。
and we don't
好，
recommend
谢谢。最后一个问题。
the
好，来
other
请
swabs, considering the
左
comfort
侧第一
level.
排考过到第一位记者。
Last question.
谢谢主持人。中央广播电视总
From
台 CGTN
CMG
记者提问。
CGTN,
据世卫组织报告，
according
全
to
球已经有多
WHO
个国家报告
worldwide,
了
several
猴痘
countries
确诊病
reported
例。
the
像猴痘
the
和不明原
confirmed
因的儿童肝
cases
炎是否可以通过
of
核酸监测发
swine
现
pox.
以及我国是否具备相
Can
关
this
的核
disease
酸
be
检测能力？
identified and
谢谢。
diagnosed with nucleic
好，
acid
我们
test,
请许文波先生来回答最后这个问题。
好，谢谢
as
记
well
者
as
的
the
提问。
hepatitis?
猴痘
Mr. Xu,
是由猴痘病毒感
as we
染
know,
导致的一种人
this
兽
disease
共患
is
传病。
led
中国
by
CDC 病毒病所
the
已经建立了针对猴痘病毒基因缩码标
monkeypox
的
virus,
PCR
and
方
China
法。
has the PCR
我
test
国呢，并且
to test
中国
it.
CDC 呢已经对其敏感性和
China
特异性
CDC
在非洲塞拉利昂进行
has
了鉴定。
done some
它已经
identification as
获得
to
了较
the
好的敏
PCR
感性
test
特异性为
sensitivity
方法。
and
所以呢，
specificity
我
in
国
Sierra
有
Leone in
能力
Africa.
通过对
So
疑似
China
输入
is
病毒
able
的临床标本
to
开展
carry out
荧光 PCR
the
检测
PCR
猴
test
痘
of
这
the
个
imported
病毒
cases
的
of
基
monkeypox
因。
disease.
这样呢，我国呢就可以及时发现潜
With
在
that
输入的
technology,
猴痘病
China
毒。
is
所以
able
我
to
国是这个
identify
能力
the
已经建立
potential
起来了。
case of monkeypox.
关于这个不明原因儿童急性肝炎，这个
As
不明原因
to
儿童急性
emergency
肝炎呢 ，WHO 定
and
义的
acute
首先排
hepatitis,
除
WHO
肝常见的这个肝
defines
炎
that
病
we
就是
must
甲肝、
uh,
乙肝、
dispel
丙肝、
the
丁
other
戊
commonplace
病毒
hepatitis,
性
for
肝炎
example, hepatitis
这个
A,
不
B,
明
C,
原因儿童急性肝炎它有个定义
especially
现
among
在
the
呢
children.
它的病因
So
还不清楚，疑似病例定义为呢，
we
就
are
是
not
自
sure
2021
about
年
the
10月
cause
1日以
yet.
来，年龄为16岁以下，患有
Ever
急
since
性肝
November
炎
of
血血
2021,
清转氨酶
for those
达到
below
500
16 years
个
old,
每升这样的病例定为
if
疑似病例，就说他一定要排除甲
their
乙丙丁戊那个肝炎。目前呢，国际
transaminase
上还
is
没有确定不明
above
原因儿童急
500
性肝炎的
units,
病原
then we
体
define
其
it
病因和
as
发
the
病机制
hepatitis among
应
children,
在持续调查和
and the
研究中。
cause and the mechanism
截至
of the
2022
disease
年6
are
月
still being
全球
investigated
已有
until
33
June
个
this
国
year.
家报告了
33
不明原因儿
countries
童急性
have
肝炎
reported
疑似
the
病例
acute
一共
suspected
是
cases of hepatitis among
651
children.
次病例。
The total
此
number
外
of
还有
cases
99例还
amount
没
to
进行分类。
650.
疑似病
90
例
cases
大
have
部分
not
是
been
在
categorized yet.
欧洲
For the
区，
suspected
就说
cases,
374
mostly of them
650一共有
numbering
374
at
其中不明原因
374
儿童急性肝
are
炎
from
至
Europe,
少38
and
名儿童需要
at
肝移
least
植来救治。
38
9
children
例
are
因
in
死
need
亡
of transplantation of
现
liver,
阶段
and there are 9 death cases.
WHO 建议
Right now,
采集疑似
WHO
患者血液
recommend
尿液、粪便
we
和呼
take
啸
the
标本
samples
必要时
from,
呢
for example, the urine,
肝活检
the
没有问题
feces,
开展相关
even the
这个病
biopsy
原
in the
的筛
liver.
查
to do the diagnosis, including, for example, the smallpox and the herpes test. And China has mature technologies considering the test and diagnosis of those etiology. Thank you, Mr. Xu Wenbo. In today's presser, our experts have taken over 20 questions from 19 reporters. Those questions include the policies of nucleic acid test, the whole chain supervision, and the role of technologies. There are a lot of technical questions and safety-related questions, and we recommend our civilians to acquire information from the official websites. There are some rumors on the websites considering the damage of the test to our bodies. We must have a clear mind, and please stay tuned with us. This is the end of today's presser. Thank you for watching.